Now, what are the possible ways to do an angiogram? Prior to or on the day of the test, the patient is asked to answer a questionnaire to ensure his or her safety. Before the test, the patient is asked to answer a questionnaire to ensure his or her safety. Therefore, an intravenous cannula is inserted into the vein of the patient, usually in the arm. The patient's hand is set with a cannula. An automatic injection pump connected to the fore cannula will give contact material at a controlled rate. The connection of the automatic injector to the cannula is connected to the catheter. With this, we can give a natural contrast. The scan of the dessert area is performed. The scan of the dessert area is performed. How does the angiogram work? Numerous X-ray beams and a set of electronic X-ray detectors rotate around the patient, measuring the amount of radiation being absorbed throughout the body. We know that the CT scan machine collects radiation from the entire area of the patient. The patient's body is bathed and the X-ray detectors are collected. The examination table is moving through the scanner so that the X-ray beam follows a spiral path. The patient's body is bathed and the X-ray detector is collected. The patient's body is bathed and the X-ray detector is collected. The patient's body is bathed and the X-ray detector is collected. When a contrast material is introduced to the bloodstream during the procedure, it clearly defines the blood vessels being examined by making them appear bright white. The X-ray detector does not allow the blood vessels to pass through the blood vessels. Let's see what cannula is used for angiogram. Cannula size is 24 G. The smaller the G, the thicker the needle will be. The bigger the G, the smaller the needle will be. The 24 G cannula is used for children. When the injection is given to the child, the injection is very effective. The green color 18G cannula is used for angiogram. The needle is not too thick, but not too thin. The needle is not too thick, but not too thin. The power injector has two series. The power injector has two series. The power injector has two series. The catheter has two heads. The brain of the subscriber can work with the channels of the channel. We have another technique to do angiogram. We have another technique to do angiogram. We have another technique to do angiogram. One is the split or timing bolus. We say timing bolus, which means the time being dependent on the bolus. Another thing is bolus tracking. We don't spend much time on it, but when we track the bolus, like a software. Bolus means contrasta. When the contrasta goes inside the atari, we track it, and whether the contrasta has reached our target atari or not, we track it. When it reaches our target, the scan starts. The timing bolus is used to track the contrasta, and then we track it. Then we give the main contrasta. This is called timing bolus. We will know more details. Now we will see how to achieve the atari enhancement. We will see how to achieve the visualization of the atari. One is if we increase the iodine concentration in the contrast media, we will see. Another is increasing the injection flow rate. If we increase the injection flow rate by 30 seconds, we will see a good atari. This is a longer injection duration. If we can give contrasta for a long time, then our ataris will look very beautiful. Larger volume of contrast. The amount of contrast is more. As you can see here, the iodine concentration is less, then the density of contrast is less. In the first image, the iodine concentration of contrast was 0.1 mg per milliliter. Because of this, the gray color is not seen much. The concentration should be increased. Here is 100 mg milliliter. The density is very good. This is the 2689 hospital. It means that the higher the concentration of iodine, the better the ataris. Here is a graph. The abdominal aorta is used for 122 milliliters contrast at 4 milliliters per second. 122 milliliters contrast is given, 4 milliliters contrast is given in every second. Here, 3 types of contrast media are used. Three types of iodine concentration. The blue color iodine concentration is 300 milligrams. Because of this, the density is less. The red color iodine concentration is 350 milligrams. Because of this, the density is more. The black color iodine concentration is 400 milligrams per milliliter. Because of this, the density is very good. The peak is very high. The hospital unit is above 350 milligrams. The next slide shows the flow rate. The higher the flow rate, the higher the density. The routine injection rate is 4 to 5 milliliters per second. We give 5 milliliters per second rate. The needle size and vent size are also important. If we increase the flow rate, it will not result in greater enhancement. If we increase the flow rate, it will not result in greater enhancement. Pulling in central venous system reflects into IBC. If we increase the flow rate, the contrast will be pulled from the central venous system. This will be seen very quickly in the inferior venous system. It will come true. The higher flow rate of contrast medium increases the outer air enhancement. We give 4 to 5 milliliters per second. This is the injection duration. It depends on how much time we push the contrast. For example, we increase the contrast between 40 seconds to 120 cc and 50 seconds to 180 cc. We increase the contrast between 120 cc to 120 cc. This is the standard. If we increase the contrast between 40 seconds to 120 cc, we will get an optimum contrast enhancement. If we want more enhancement, we can increase the contrast between 40 seconds to 180 cc. The iodine contrast needed for greater arterial opacification with higher iodine flux at the time of the scan. It depends on iodine concentration, flow rate, injection duration, and the percentage of iodine in the contrast. It also depends on the time of the scan. Now, we will discuss about saline chaser. We give the contrast through the automatic injector. We push the contrast through the saline injector. Saline injector pushes the contrast through the saline injector. This causes the contrast to penetrate the blood vessels. It pushes contrast in the turbine and peripheral veins into the central veins. We push the saline injector through the saline injector.